We have a little saying that radiology sees you before you see the world. The importance of radiology starts in pregnancy, so radiology sees you before you see it, and it can diagnose a little embryo before it even forms body parts, through all stages of life to the elderly and then end of life. There are more than 25 million radiology procedures each year, so if you think of that, that's at least one study per person in Australia every year.
Radiology is a foundational part of the health system. For me, in my normal day, it is crucial in being able to make a diagnosis, to be able to reassure somebody that they don't have something bad, but if there is something serious, to be able to more clearly determine what it is so that an individual can get the right treatment. You know, we need ultrasounds for mothers who are pregnant. We need x-rays for broken bones that kids suffer when they're out on the sporting field. We need those crucial other tests to determine serious diagnoses as people grow older, and you know, it becomes a very, very critical part in being able to determine critical diagnoses.
Melanoma, unfortunately, is something of an Australian cancer. Approximately 15,000 Australians each year will develop a melanoma. And certainly the management of melanoma has just been revolutionised in recent years with new treatments, which has been very exciting. And that's also, though, changed the way we use imaging in melanoma. It's not just a sort of three-dimensional anatomical view of things now. It's a way of functionally imaging to be able to light up those things like a Christmas tree that show bits of melanoma that we wouldn't necessarily know were melanoma just by looking at the straight images. So that's really changed the way we approach things.
Imaging has been the biggest single impact in the management of prostate cancer in the last 30 years. It helps us avoid unnecessary biopsy, avoid unnecessary treatment, and multi-parametric MRI and PSMA PET scanning and ultrasound has completely revolutionised the way we treat things.
I'm an eye cancer specialist, so radiology is a very integral part of the work that I do. I use CT scans, MRI scans, and also ultrasound. So it's really important, particularly when I want to diagnose and treat tumours within the eye. Ultrasound for me is one of the most important things that I use.
In a centre like this, where we have high-level, high-performance athletes who are acquiring skills to be able to go to the Olympics, go at the highest performance they can possibly achieve. And we're using lots of science, lots of imaging, lots of ways of getting the best performance possible from every angle. Radiology is one of those components because that tells us how healthy those tissues are. It assists us in programming from an injury or finding out about an injury even before it's happened or it progresses further.
During a typical week, most surgeons would see, a number of new patients, and for me, there's the odd high-level player or elite athlete, but most of the patients are your weekend warriors or patients that have injured themselves, not actually playing sport, but doing outdoor activity or work around the house. X-ray is very important in orthopaedics because generally we're getting down to operate on the bones and around the joints. Over the last decade, MRI has become pivotal in helping manage the sports injury side of orthopaedics because it gives us a good insight into the soft tissues and ligaments around the joint.
MS has changed a great deal over the last 30, 40 years, and one of the most critical drivers of that has been the introduction of MRI, which is now really not just a critical component of the diagnosis. It's actually become absolutely crucial in terms of both monitoring the patients as far as their disease progression, and also changes our management strategy. There is this window of opportunity early in the disease to get treatment in place that prevents accrual of longer-term disability, keeps people in the workforce, and therefore reduces the economic burden. And imaging is really now the linchpin of that.
Australia actually, on the world stage, is actually technologically very advanced. When you treat a disease, the earlier you diagnose and treat it, the much better is the prognosis.
From my perspective, radiology is absolutely a critical part of what I do. It is a critical part of my patient's journey from the moment they are diagnosed through to planning their treatment, through to their long-term follow-up.
Radiology is an integral part of the health system, and to some degree they're the unsung heroes because quite often they do their work behind the scenes, but without them we wouldn't be able to make critical diagnoses, get the right treatment, and we'd be actually lost in being able to provide the sort of care that's required in a modern health system.
For me, radiology is an essential part of my practice to give the best management for my patients. In the country, in Australia, we couldn't do without radiology. It's absolutely vital for the better health of Australians.